Good afternoon. Thanks so much for your interest in this Leading Age Virginia update on Virginia's recent unprecedented special session of the General Assembly. I am Dana Parsons, Vice President and Legislative Counsel with Leading Age Virginia, and joining us today is Alicia Cundiff with Spots Fane. Alicia and I will provide a brief overview on some of the key legislation that was approved by the General Assembly and our Governor, Ralph Northam, that impacts the continuum of aging services. Alicia, could you please share with us a little bit about how Spots Fane supports Leading Age Virginia at the General Assembly and why this special session was needed?
Yeah, absolutely. Thank you for having me. I work at Spots Fane Consulting, and we are a government relations firm in Richmond, Virginia, and we represent Leading Age Virginia in that capacity. And our role looks like interacting with the government on a number of levels, mainly the General Assembly, but also the executive administration as well as the regulatory agencies. So we work to represent Leading Age's interests and any legislation that they need help with advocacy on, and tracking that legislation, and maintaining good relationships and bipartisan relationships with legislators in order to advance the goals and needs of Leading Age. And then why this special session was needed. Originally, the purpose was for COVID-19 and the budget. The governor's administration is projecting a $2.7 billion shortfall in the budget. So really the original reason was for the legislatures to come in and essentially redo the budget of what was done in January. And then also have the opportunity to introduce legislation around COVID-19, which is some of the legislation that we'll be talking about to you all today. But secondly, after the death of George Floyd, the second reason for convening was really to address issues of criminal justice and social justice within our Commonwealth.
Thank you, Alicia. Could you talk with us a little bit about the legislation that was approved requiring the Commissioner of Health to make information available on a public website when the governor declares an emergency in response to a communicable disease such as COVID-19?
Yes, so there were two bills that passed out of this special session relating to making information about COVID-19 available on a website and just transparency around that. So the first bill has to do with what you're seeing right now on the slide, has to do with this specific state of emergency that we're under in regards to COVID-19. And it requires the Department of Health to provide a lot of different kinds of data available on their website, including the name of the reporting entity, the total number of confirmed cases, and those cases by age group and by race and ethnicity, and the percentage of cases if they're associated with a nursing home, assisted living facility, or correctional facility. It also requires the Department of Health to provide analysis on that data and to publish COVID-19 indicators such as case incidence rate, percentage of PCR tests that are positive, the rate of COVID cases that are linked to an ER visit, the rate of COVID cases that are in ICU, and the percentage of hospital beds that are currently occupied. And then on the next slide, is a second bill relating to, this bill relates to any communicable disease of public health threat. So not just the emergency order that we're under right now with COVID-19. And this bill requires that the Virginia Department of Health report the name of the reporting entity, the number of cases, and the number of deaths. So the first bill has a lot more data that it is asking for, but it's only specific to COVID-19. And the second bill, while it doesn't have as much data that it's asking for, is broader in that it is not just for COVID-19. It'll be for any communicable disease public health threat moving forward.
Alicia, do we know when this bill will become effective?
Okay, we might have to pause the recording.
Sure, we can come back to that. I
Okay.
believe that all this legislation was recently signed by the governor, and the different agencies are working on it to implement it. So
yes, I do know for most pieces of legislation, it unless there's an emergency clause on them, it'll go into effect in March 2021.
great, thank you. So we had another very interesting bill related to immunity from civil liability. This legislation provides that in the absence of gross negligence or willful misconduct, licensed adult days, assisted livings, home cares, and hospices have been extended to civil liability during COVID. Virginia Code already extends this liability protection to certain medical providers, including nursing homes, during disasters and emergencies, except in the case of gross negligence or willful misconduct. This legislation contains an emergency clause, so it was effective upon the governor's approval, which was October 13th of this year. But this legislation and civil immunity provided will only apply to causes of action arising between March 12th of 2020 and such time as the declaration of a state of emergency related to the COVID-19 virus set forth in the governor's Executive Order 51 is no longer in effect. There was another measure that was approved this session related to visitation protocols for nursing homes and hospice communities. This legislation is requiring the State Board of Health to amend its regulations governing nursing homes and hospices to require that during a public health emergency related to COVID-19, that each nursing home and hospice establish a protocol to allow residents and patients to receive visits. Specifically, the protocol in the regulations must include the following 4 areas. The conditions, including conditions related to the presence of COVID-19 in the nursing home and hospice, under which in-person visits will be allowed, and under which in-person visits will not be allowed and visits will be required to be virtual. The requirements that in-person visitors will be required to comply to protect the health and safety of the residents and patients and staff of the nursing home or hospice. The types of technology, including interactive audio or video technology, and the staff support necessary to ensure visits are provided. And last, it must include the steps the nursing home or hospice facility will take in the event of a service operation or documented emergency that prevents visits from occurring. The protocol must also include a statement of the frequency of visits that will occur, including virtual and in person, that will be allowed, and they must be at least once every 10 calendar days for each resident or patient. A provision authorizing a resident or patient or the resident or patient's personal representative to waive or limit visitation, provided that the waiver or limitation is included in the resident's health record. So because this legislation refers to nursing homes and hospice, this language is being used interactively, residents or patients. A requirement that each nursing home or hospice publish on its website or communicate to each resident or the resident's authorized representative in writing or through electronic means the nursing home's plans to accommodate these visits. The governor approved this legislation on October 21st of this year. This legislation also contains an emergency clause and requires the Department of Health to develop regulations to implement the provisions of the law to be effective within 280 days of its enactment. The Leading Age Virginia is serving on a regulatory panel that is working directly with the Department of Health to develop these regulations. Leading Age Virginia is then working with our Public Policy Committee to ensure that the regulations and amendments and so forth that we suggest reflect requirements that absolutely will ensure positive aging for all Virginians. As soon as the final recommendations are approved, we'll share that information with the membership. So Alicia, moving on to the budget issue, which you had mentioned earlier, what is the status of the state budget as far as impacting nursing homes and aging services?
Yeah, so really the big thing, which is a big win for the aging community, is earlier in the pandemic, uh, nursing homes and assisted living facilities were starting to receive an additional $20 a day through Medicaid in additional funding. And in the state budget that was passed during this special session, that additional $20 a day through Medicaid was extended, and that'll remain in effect through June 30th, 2021.
Thanks, Alicia. So thank you today for the opportunity to provide you with a legislative and regulatory update. The next General Assembly session is scheduled to convene on Wednesday, January 13th, 2021, and we will be providing you more legislative updates at that time. So thank you again, and please let us know if you have any questions. You can contact me at the email address here on the presentation. Thanks again.